Hi, today we're going to discuss the process of performing a head to toe physical assessment. Before we get started, we're going to go over the tools or equipment you may need to perform the physical assessment. You will need a stethoscope, blood pressure cuff. You may need a visual acuity chart. You'll need an otoscope. You may need a tuning fork to assess ears and hearing. You're going to need your thermometer, a reflex hammer. If you're performing a female vaginal exam, you'll need a vaginal speculum, and then you also need lubricant, and you'll need lubricant if you're going to be performing a rectal exam or a prostate exam on a male. You may need a dermoscope if you need to further assess any skin issues. You may need equipment for sampling, such as swabs, specimen tubes, or specimen cups. You'll need a tongue depressor and a tape measure or ruler. You'll need a light and a timer. And then you may need procedure masks, and you'll want to don gloves. You also may need a Doppler ultrasound in case you are unable to palpate any pulses. Okay, so now we're going to move into the physical assessment. But before we begin, you want to assess your environment to make sure that you have appropriate lighting, that you are able to provide privacy for your patient, and that you are able to have a place where they can have proper positioning for certain parts of the exam. Once you have established that, you want to make sure that you have, they're going to be wearing a gown also, that you only cover up or uncover the areas that you're assessing at that time. Upon entering, you can do your general survey. At that time, you're going to look at the patient. You're going to assess their affect. You can assess their hygiene, if they're dressed appropriately, their stature, general skin appearance, and tone at that time. You can also get some idea of cognition and mentation at that point, and level of orientation. Ask them a few questions. So we'll begin by, hi, my name is Liz. I'm going to be performing head to toe physical assessment today. Is that okay? Okay. Can I have your name and your date of birth, please?
Dylan Cameron.
And what's your date of birth?
2010, 6/11.
Okay. Dylan, do you know what year it is?
Yeah, it's 2023.
Okay. Do you know who the president is?
Joe Biden.
Okay. So questions like these, and including like why they're here and where they're at, will help you give you an indication of their orientation. After that, you're going to perform vital signs. So we're going to do we're going to take the patient's blood pressure. With the blood pressure cuff, and placing the diaphragm of the stethoscope over the brachial pulse. You're looking for a blood pressure that is less than 120 over. Using the radial pulse and the pads of your index finger and middle finger, you will count the pulse for 1 minute. Then you will also count respirations for 1 minute. Then we will take temperature. And you can assess the pulse oximetry. Now, during the assessment, you want to typically move head to toe the best you can, and then in each section you will inspect, palpate, and percuss, and then auscultate. And then and you also want to try to minimize position changes as much as possible for the comfort of the patient. So when we start, we're going to start with the head. So we're first going to just inspect the head. We're going to inspect the skin of the face. And then you're going to look for any dryness. You're going to look for skin tone. And then we're going to look at the hair to make sure that it's distributed evenly, that there's no thinning spots. We can feel the scalp at this point. We can feel for lesions and bulges, indentations. You can look for lice. And then and when we look at the eyes, we're going to look at the eyes. We're going to make sure that there's no sagging in the eyelids. We want to look at the sclera to make sure that those are white, not yellow, and make sure the irises are clear. And then we can look at the symmetry of the face to make sure there's that it's symmetrical, that there's no drooping or anything on one side. And then with a light for the eyes, we can assess the pupil reflex response. We want to make sure that the lens is clear and the pupil is reactive to light. Also looking at the vasculature in the eyes. Then we can move to the ears. We're going to look at the outside of the ears to make sure that there's no drainage, no redness or inflammation. We're going to use an otoscope to look at the ear canal, to make sure that there's no redness or inflammation, and look at the eardrum. The eardrum should be pearly gray. There should be no bulges or redness, and you should be able to visualize the eardrum. At this time, you can also assess hearing, standing behind the patient. You can let the patient know that you're going to whisper some words next to their ear and have them identify what you said. So
4, 7, 8.
All right, and then you're going to do that on each side. If you identify that there is hearing loss, or if they tell you that they have been experiencing hearing loss, you can move on to using the tuning fork to assess bone conduction or air conduction, and then lateralization. Also, before we move on, you can use a visual acuity chart to assess the patient's vision as well. Then we're going to move on to inspection of the nose and the nasal mucosa. You want to look at the nose to make sure that the nostrils, there's no flaring and that there's no drainage coming from the nose. Using your light, you're going to look inside the nasal passage. The nasal mucosa should be pink and moist. There shouldn't be any excess drainage. You're going to look at the bone structures inside the nose and make sure that there's no deviations. Then you can look at the lips. They should be pink. Blue, bluing in the lips would indicate hypoxia. You want to make sure that there's no excessive dryness. Then we can look at the gums and the teeth. And the gums should be pink, no bleeding. And you want to assess for any teeth that may be missing or chipped. And then we can look using our tongue depressor. You can look inside the mouth and open up, please, and say, ah. So you want to assess to see if the palate, when the patient says ah, is moving up. You want to look inside the oral mucosa, make sure that there are no lesions. It should be moist and pink. You want to assess the tongue to make sure that the papilla are evenly distributed. There's no white film. If there is white film, you can use your tongue depressor to scrape it off to assess for thrush. If it's not easily removed. You can also use the tongue depressor at this point to assess the gag reflex at the back of the tongue or the throat. And then you also look at the tonsils and the pharynx. And the tonsils you're going to look for inflammation. There should be no lesions on the tonsils, should be no lesions in the pharynx, and no drainage. Okay, so continuing with the cranial nerve exam, I'm going to have the patient, you could pop out your cheeks for me, thank you, and smile, show me your teeth. Good. Raise your eyebrows for me. Good. Also, at this point, we will assess the temporomandibular joint, which is part of the musculoskeletal and the neurological for the cranial nerves. So if you place 1 or 2 fingers in front of the tragus and have the patient move their jaw side to side and forward and back and up and down, you're going to feel for any crepitus, any popping. And then you can also feel for, at this point, the cervical lymph nodes. So with the tips of your fingers, you're going to palpate around the jawline and the ears, and then down the neck, across the clavicle. And you're going to assess for any enlarged lymph nodes and any tenderness. To continue with the cranial nerves, you have the patient flex the muscles in your neck, please. Good. And then raise your shoulders and relax. Okay. And the patient should be able to do that, and they should be symmetrical. Okay, now we're going to move on. We're going to assess the chest. We're going to observe for symmetry and dimension. Any asymmetry could indicate that there is a respiratory issue, pneumothorax. Abnormal dimension could indicate COPD. And the chest or the thorax. Um, so we're going to we can start palpating. We can start with palpating since we're moving down. You can save this for the cardiovascular assessment, or you can do that while you're doing the neck. But palpate for the carotid pulse. So you're going to use the tips of your first two fingers and feel for the carotid pulse. And you want to do both one side at a time as to not cause syncope. All right, so we're going to palpate first the axilla. We're going to palpate for the axillary lymph nodes. We're going to again look for any enlarged lymph nodes and any tenderness. And then we're going to have the patient sit in an upright position. And we're going to palpate the spine and the muscles of the back. So you're going to use the tips of your fingers to walk down the spine and feel for symmetry. And then for the muscles, you're going to use the tips of your fingers first. And then the palm of your hand. And you're going to feel for bulges, spasms, and tenderness. And remain sitting upright. Pericardium. And first with the tips of your fingers, then with the palms of the hands, feel for the presence of palpation. And then the apical pulse. And then sitting upright. We're going to percuss the lungs posteriorly. So you can stand behind the patient with the patient in the seated position. So with resting the middle finger on the patient of one hand and then using the first two fingers of the other hand, and you're going to go in a ladder pattern and you're going to palpate, you're going to tap. In all the lung fields. And you're going to assess for any tympany or any dullness. Dullness could indicate an effusion or a mass. And then we're going to move to the chest and palpate the chest. So the same with the middle finger of one hand and using the first two fingers of the other hand, we're going to tap. You can have the patient can be in the semi-Fowler's position for this. And then you're going to kind of move in a vertical pattern up and down the chest. And you're going to listen again for tympany and dullness for that. And then, so I'm not going to yet palpate the abdomen. I'm going to, because for the abdomen, we'll do out of sequence because palpating and percussing the abdomen will change the vowel sounds. So you want to auscultate that first. So we'll auscultate the chest, the heart and the lungs. So anterior and posteriorly. So first we can auscultate the carotid and using your stethoscope with the diaphragm. You can use the bell of the stethoscope to auscultate for any bruits. And for heart sounds, again, using the stethoscope and using your diaphragm, you're going to move through each oscillatory field. And you're going to move down this the right and left sternal edges. And the lower sternal border and the apex. And then to listen more closely for murmurs, you can use the bell of your stethoscope. And we're listening for S1 and any abnormal heart sounds such as murmur. We can now listen or auscultate the lungs. So since we have the patient in this the semi-Fowler's position, we can auscultate anteriorly. So this is best for the upper lung field. So we can start and then take a deep breath for me. Good. And you can start with the area above the clavicle. And then again in a ladder pattern, you move one side and then to the other. All right, very good. And now to assess the posterior thorax and the lungs, I'm going to have you actually turn a little bit. There we go. Okay, so we're going to assess the symmetry of the back. What I'm going to do is take the palms of my hands and place it with the thumbs on either side of the spine and take a deep breath for me. And I'm going to watch for as the patient takes a breath, as my hands to move out and then in and symmetrically. And then I'm going to listen. We're going to auscultate. And you're going to listen in all lung fields and moving in a ladder pattern. So take a deep breath, please. Okay. And again. Listening for is in the adventitious breath sounds. I'm going to listen for crackles, wheezes, bronchi. Now at this point, we can have the patient lay in a supine position. So if you could lay down, please. And we will assess the abdomen at this point. And like I said earlier, we will actually auscultate the abdomen first, so not to alter the true vowel sounds. So you're going to listen in all four quadrants of the abdomen. Before doing this, however, you can inspect the abdomen, inspect for symmetry, no bulges. You're going to inspect that the skin has no lesions or that it's evenly colored and that the umbilicus is not red or inflamed. And then we will listen and vowel sounds should be present in all 4 quadrants. And it should not be hypoactive or hyperactive. And then we can move on to percussing, so that the abdomen, and we will find the edges of the liver during this. So again, in the vertical zigzag pattern, starting from the right lower, and using the same technique as percussing the chest and the lungs. You're going to use the middle finger, place the middle finger of one hand lightly on the patient, and using the first 2 fingers of the opposite hand to tap. And you will hear for the dullness of the liver versus the more aerated areas of the bowels. So I want you to determine where the liver edges are. You can feel for the liver by placing your left hand underneath the patient's back and pressing upwards to bring the liver to the surface. And then you can palpate. And you can note the size of the liver, and then you can use your tape measure or ruler to measure the size, the liver. Then we're going to palpate the abdomen. You can start with light palpation. So with the tips of your fingers, just go across. And you're going to palpate for any masses or tenderness. And then you're going to palpate further and deeper palpation, palpating for pain and masses. And if there is pain, you're going to note whether it is pain with palpation or when it's released. You can also palpate down the center for the aorta. And typically the kidneys are not palpable, but to attempt to palpate the right kidney, you're going to use your left hand underneath the back between the 12th rib and the iliac spine, and press up and attempt to palpate. And typically the left kidney is not normally palpable. If it is, that would indicate that there is that's an abnormal finding. There's some inflammation. If the patient is having pain when palpating the kidneys, you can further evaluate that, having them sitting in an upright position using the closed hand and gently but firmly tapping on the flank to elicit a pain response. All right, and then, okay, you may sit up. Okay. So we are going to complete the inspection for the cranial nerves. Now, when we did the head and the ears, or head and the face and the cranial nerves there, we did not assess smell. So before we move further, we're going to use a scent that is easily identifiable. You've already assessed whether the nasal passages are clear. Have the patient close their eyes and then put the scent underneath the nose, and first ask them if they can smell it.
Yeah.
And then you can ask them to identify the
Cinnamon.
scent. Okay, thank you. All right. And then we'll continue with the neurological assessment by testing sensation at this point. You can use a cotton swab or a sharp object like a safety pin. I am using a bent paper clip as a sharp object. So what I will do is have the patient close their eyes. I will let them know this is what you're going to feel. And when you feel that, just say now. And I'm going to start with from your face and move down your arms and then your legs. Okay?
What about the dull side?
We're just going to do the sharp side.
Okay.
Okay. You can just say now and you feel it.
No. 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 No.
Okay. Very good. All right. And then also when assessing neurological part of the exam, after testing sensation, we can test coordination. So if you would touch your nose and then touch my finger and continue with that. I'll do as fast as you can. Okay, good. And with the others. Good. Okay. And then what I'm going to have you do is with the palm of your right hand, you're going to flip it and do as quickly as you can. Good. And then repeat with the other side. Good. Okay. Okay. And with the patient in the either this semi-Fowler's or the upright position, you can palpate for the pulses at this point. You can, we're going to palpate for using the first two fingers. You're going to palpate the brachial pulse and the radial pulse, and you're going to do that on each side. And then you're palpating for rhythm and intensity. You'll palpate the femoral pulse, and you'll palpate the popliteal pulse. The tibial pulse with your hand cupped around the back of the ankle, and the dorsalis pedis pulse using your first two fingers. And it's usually near the ankle. So we are going to check the reflexes at this time also. So using a reflex hammer, you're going to have the patient, if we can relax. And we are going to palpate the bicep reflex. And you're just going to feel for a kind of a twitch. And then the tricep reflex, which will be right above the elbow. And then you're going to do the same for both sides. You're going to do the patellar reflex. And you can have the leg relaxed. And then do on both sides. And then we're going to do the brachioradialis. This is best done. And then the patellar, or we did the patellar, the Achilles on both sides. And then the plantar reflex, which will be the you can use the handle of your reflex hammer or a tongue depressor, and you bring it from the lateral plantar side of the foot and draw it up. And then a normal response will be for the toe to point downwards. The toe pointing upwards would be a abnormal response. All right, so we're going to assess the peripheral vascular of the extremity. So we want to assess warmth of the extremities moving down, and they should be warm. We want to look at hair distribution to make sure that it is even and that your color is, there's no discoloration. We'll assess the fingernails, and they should be pink. And we can do our capillary refill. And the refill should be brisk, and you should less than 2 seconds. And do it on the toes as well. And then also at this time, we'll assess the edema on the lower extremities using the first 2 fingers and press and hold for about 2 to 3 seconds and release. And then if there's indentation, you are going to assess the amount of time it takes for that indentation to disappear. And that is how you will rate your edema. And then we can have the patient sitting upright. We're going to assess musculoskeletal. First, we will look at our joints, and we're going to look for any redness or edema. Redness or edema could indicate an injury or arthritis. Then we're going to, with one hand placed over the joint, we're going to put it through a range of motion, feeling for crepitus or popping, any pain. We're going to do all the joints and bilaterally. And we're going to do it with the lower extremities as well. Looking for that crepitus tenderness. And then if for men in our physical assessment, we could also palpate the rectum and prostate, and you're going to look for any pain, redness, swelling, hemorrhoids, anything like that. All right, so continue with the musculoskeletal assessment. We're going to have the patient stand. Okay, and have you step. Come over here for me. And then we're going to walk heel to toe.
Good. And then come back. And I'm going to take it. We're watching for balance, their gait, watch, and then heel, walk on your heels for me. We're assessing their mobility and the tips of your toes. Tips of your toes.
Oh.
Thank you. And balance also. Now, we're to assess balance. We'll have the patient stand with feet together, hands by your side, and close your eyes. And we're going to count to 30 seconds. And then this is how we assess balance. Some swaying is normal. Okay, and you may have a seat.
Documenting your findings is the final portion of your physical exam. When documenting your findings, you want to provide a clear, unbiased, and concise report. You want to make sure the report is comprehensive to ensure that other members of the care team have a good picture of the patient. It should, so the documentation for this particular patient would read something similar to this. Vital signs within normal limits, patient alert and oriented, head with no bulges, lesions, or indentations, face symmetrical, eye symmetrical, sclera white, lenses clear, pupils even and reactive to light, ears without drainage, canals without edema, eardrum visualized with no bulges or edema, nasal passages clear with no drainage, nasal mucosa pink and moist, lips pink, no dryness, oral mucosa pink and moist, no lesions, teeth intact, gums pink with no bleeding or edema, tonsils and pharynx with no edema or lesions, and no drainage. Tongue pink, palate reactive, cranial nerves intact, lymph nodes non-palpable, non-tender, all pulses palpable, chest symmetrical, heart sounds S1 and S2, no murmurs or bruits, lungs clear with no adventitious breath sounds, abdomen soft and non-tender, posterior thorax symmetrical, muscle tone even throughout, skin color even and normal for ethnicity, skin temperature even and warm, reflexes reactive, gait normal.